Welcome to Direct Supply's Continuing Education webinar series. Direct Supply offers monthly webinars on a variety of topics throughout the year. The topic for today is reducing falls in older adults. My name is Savannah Ocasio, and I will be facilitating today's meeting. Please note, the information contained in this presentation is intended to provide general information, but not advice about certain regulations and initiatives. This is not intended as legal or other advice, and each situation may vary depending on the particular facts and circumstances. You should not act upon this information without first consulting with qualified legal counsel. Today's webinar will be presented by Liz Jensen. Liz is the Clinical Director at Direct Supply. She works with senior care providers, product managers, and engineers to translate evidence-based research, regulations, and risk management strategies into practical processes and applications for clinicians and frontline care providers in senior care. Liz leads the Direct Supply Spark Collective clinical and interprofessional collaboration of senior care nurses, therapists, physicians, pharmacists, and others who test and pilot new products and services that improve outcomes for seniors and evaluate quality and efficiency for care delivery to a new level. She hosts an annual leadership conference for nursing and therapy executives and works closely with local nursing schools to inspire the desire to work in senior care. And now please welcome Liz.
Hi, thank you, Savannah. Hi, good morning, everyone. As Savannah said, my name is Liz Jensen. I'm the clinical director here at Direct Supply. I'm joined today by Renae Buyeske, who's our program consultant, and she'll be speaking a little bit later today. We do have some learning objectives, some things that we're going to cover today. We're going to look at evidence-based strategies to reduce fall risk in older adults. We'll discuss strategies for building competency and capabilities to reduce fall risk in assisted living and skilled nursing centers. And we'll understand how to apply two effective education techniques to engage audiences with varying degrees of knowledge and experience in reducing fall risk in older adults. So my goal here today is really for you to walk away with some practical ideas for how do you implement this within your organization. So we welcome a lot of providers to Direct Supply every year. I think last year we had something like over 500 people that came to visit our team here that are coming to talk about various topics and issues related to improving quality and improving outcomes in senior care. Some of the more common questions that I hear providers asking us, specifically related to falls, are here on this screen. Things like, how do I decide where to focus my efforts? What works and what doesn't in reducing fall risk? How can I help my team? What about products and technology? What's the latest and greatest there? And ultimately, how do I balance resident choice with safety, which is ultimately, in many instances, what it comes down to. So we're going to talk about some ideas that answer some of these questions today during our time together. So when I think about fall risk reduction, the idea, and again, holding this in your mind, that the need as a operator, a need as a leader in your organization, is really to be able to hold multiple ideas in your mind and focus on many things all at one time. So today what we're going to do is we're going to dissect the process of how we really go about looking at fall risk reduction through these lenses. So we're going to look at some ideas specifically related to programs. So I'm going to give you 3 ideas there. I'll also give you 3 ideas related to how to improve processes and some new ideas perhaps to think about related to that. We'll also look at 3 ideas related to how to think about selecting products and technology when it comes to reducing fall risk, and ultimately 3 ideas related to practice. So there's plenty of more ideas within each of these lenses for sure, but to try to give you some practical things that you can take away with you today, we're going to really hone in on kind of 3 main things. Ultimately, all of these move us towards this focus around person-centered care. And the need to be able to meet residents where they are, understanding that people have the right to make choices. They're moving into your communities with equipment and supplies and furniture and all sorts of things that they've been living with that you have to continue to learn how to tailor and make specific to the residents. So having a good program mind in place and having good processes in place will help you prepare to provide that person-centered care. So this is how we're going to take a look at it. We're going to take a look at first the program level. So the three big areas that I want you to focus on today are related to organizational support, commitment to best practice, and prioritization through QAPI. When we talk about organizational support, this is really crucial, and for the leaders on the team to recognize that the resident population that you're admitting and caring for that are moving into your communities today look very different than they did 10 years ago. Many of the residents are older, they have more chronic conditions. These are all things that I know that many of you know and are aware of. But understanding and really recognizing that in order to be able to focus fall reduction efforts, that you really have to have the support of your organization to do that. And so looking at how your teams think about fall risk reduction, how you prioritize that through your daily practices really makes a difference. And I work with providers at times when the teams aren't always on the same page. So the executive director may have a different focus and belief about what a fall risk is compared to what a clinician might. And so making sure that you are all seeing your program and focusing on your program development in the same way. So let's dig into some of these elements just a little bit further. So when you're thinking about your program, the first question I always ask providers is what is your organizational capable of, and what are you willing to do when it comes to reducing fall risk? Now, some of the strategies that we're going to talk about today might involve products or technologies that may not be appropriate for your community. And that's okay. I think that it's important that you're able to define what works within your state regulations, what works within the requirements within your existing organization, what you're capable of, and then what your team is willing to do. And sometimes those are limitations that you may not have a lot of control over, especially if it's related to staffing issues or other types of services that you can provide within an assisted living environment. It's important to define your organizational standard. And when I say organizational standard, it means what are we promising to our to the people who are moving into your community, and establishing what that standard is. Clarifying between your sales team and your operations team, your clinical team, what we're talking about when we're talking to our residents and families, making sure that we're not promising that a resident is not going to fall once they move into your community. But sometimes those are the, if not overtly communicated ideas, sometimes they're the non-verbalized promises that get made, and or beliefs or desires that the family might have related to the resident moving into the community. So it's important that you're realistic about being able to reduce the risk of falls and the ability to do that, but not promising that their mom might never fall. I think this is really critical to include everyone in your fall prevention program in your community. And again, this might seem obvious, but when I say everyone, I mean everyone, including the people on your housekeeping staff, the people that work in your dining services, contracted employees that might be coming in from outside to provide services, physicians, pharmacists, family members. This needs to be a team effort in order to really build a successful fall risk reduction program. It's also important to define what the metrics of success are and using standard calculations, and we'll look at that here in just a moment a bit more as well. And again, focusing on what you can control. There will always be those elements that involve resident choice, what they're willing to participate in, what they're not willing to participate in, and we'll talk a little bit more about that. But ultimately understanding that there's certain things that we won't be able to control. Working with senior care providers for many years, I worked in long-term care for a number of years on the skilled nursing side. And, years and years ago, when restraints were being utilized, they were initially implemented really with this idea that our whole goal was to try to keep people safe. We learned and understood, and evidence has shown us that restraining people doesn't work to reduce fall risk, and it comes with a whole host of other issues as well. So the more we're seeing residents reduce their mobility, the more that we see them being fearful of falling and therefore maybe not participating in activities. Those are all signals to us that there are things that we might be able to do that are within our control to help the resident be more participate more, but we really need to focus on that and help them understand that and recognize where we can and can't control. So those are some thoughts related to organizational support. Let's talk a little bit about when I talk about commitment to best practice and what I mean when I talk about best practices. So a best practice, by definition, is a procedure that has been shown by research and experience to produce optimal results and that is established or proposed as a standard suitable for widespread adoption. I like to share that definition because it's important that when we talk about best practices is something that isn't just a practice that's been passed down from person to person, but it's something that's actually rooted in research. It's actually rooted in what we understand about best practices, or what we understand about what actually helps and moves the needle. The CDC has some great resources. The STEADY program, Stopping Elderly Accidents, Deaths, and Injuries, is a whole host of resources that are available. They're free for providers. You can see on the screen here that there's resources available for healthcare providers as well as resources available for older adult patients as well. If you haven't looked at these materials, I would strongly encourage you to do so as a team. There's great resources here. There's assessment tools, educational tools, and tools that can help with developing your program around fall risk reduction. And they're evidence-based and will give you some really good direction when you're developing your process. So when I work with providers, I often will talk about how do we make sense of the evidence that's out there. And if you were to do a Google search today and look for the latest research related to fall risk reduction, you would be overwhelmed. There's been so much research that's been done over the years that slices into just the very simple issues related to fall risk reduction, like effectiveness of a certain intervention. But then there's also research that looks at more at programs more broadly. When I look at that body of research, there are a few things that really jump out to me that I want to make sure that I shared with you today, and that I often am seeing when I'm working with senior living providers as sometimes it's seemingly obvious issues that should be in place already, but are often things that get overlooked. So we're going to talk about all of these today, and I won't read them all to you right now, but they're grouped according to assessment-related pieces of evidence, some strategies, and then some ways for providing education. And then the last big area that I just wanted to mention around prioritization through your QAPI or your QA process, whatever the process is that you are following to look at your quality assurance and performance improvement activities. Fall risk reduction should be a part of that ongoing program monitoring. And I would encourage you to look at how you're measuring and what metrics of success that you're utilizing. The study materials that I pointed out earlier will provide you with some instruction and some education about how to measure fall injury rates and different ways to use metrics to manage your falls. I'm sure many of you have already been finding the importance of capturing those rates. People want to know that. When I say people, I mean hospitals want to know, family members might want to know, insurance companies may want to know. So being able to capture your data and be able to speak to your data is important. And these are all areas that are metrics that you may want to consider including in your QAPI process. All right, let's move into the next big circle. So the next subset of processes that we're going to take a look at are related to assessment, focus, and innovation. So I wanted to make a couple notes about assessment. There are a number of fall risk assessment tools out there. Again, the STEADY program has some great fall risk assessment tools if you're interested in looking at those. I do want to just make a couple notes about some of the common things that I tend to see as I'm working with providers is many senior living providers have some element of a fall risk assessment built into their move-in assessment or their intake process. I would encourage you to look at that assessment and compare it against some of the points that we're going to talk about here on the next slide. But the risk that's associated with some of those risk assessments include things like scoring. If the fall risk assessment that you're using puts people into or gives someone a score after it's completed, keep in mind that the scoring is really meant to benchmark the resident against themselves and shouldn't be used to benchmark against other residents in your community. Scoring sometimes can be problematic, especially when we talk about how do we know who is really at risk. Many providers come in with the assumption that everyone is at risk for falls and that the assessment is really meant to help us further understand where the higher levels of risk exist. That's important to understand and to really dig in and look at your initial fall risk assessment, what the information is giving you, and then how that information is being used. Keep in mind that those risk assessments are just a snapshot in time and that things can change. Sometimes they can change quite quickly. If someone's ill, if somebody gets a new pair of shoes, if something's spilled, if they went to the eye doctor and had their eyes dilated and tested. So the things that change on a daily basis that put someone at risk for falls is really ever-changing. And so keep in mind always that those risk assessments are just that snapshot in time. And then making sure that whatever tool that you're utilizing, if you are using it to score, that you're using a tool that's been validated and that has some of the core elements of a fall risk assessment, which we'll look at here in a moment. It's important to ask who is doing that assessment. By Practice Act, a nurse in most states is a registered nurse is the only person who can officially conduct an assessment, or a therapist or a physician, for instance. But there may be some data collection, data evaluation elements that an LPN or others on the care team might be able to collect. And so making sure that whoever is collecting that information, ultimately that the assessment of all of that information is being, and how to interpret that information is being done by the right care provider in your organization. And then the last big question to think about is how often are you reassessing? Most providers that I talk to have some type of a reassessment process that's tied around perhaps maybe it's every 6 months or it's with a change in condition. But that becomes difficult, especially when a resident may be having some of those more frequent changes that are occurring and that we may not be able to reassess. So anyone on the team should be empowered to bring forward to the leadership their concerns about a resident's safety, and that you may want to consider that as being a trigger for conducting a reassessment for their falls. So just because you have a policy set for a certain period of time doesn't mean that it can't change or shouldn't change according to what the resident's needs are. So some of the key things when you're looking at your fall risk assessment then is to make sure that the assessment includes a focused history, that you're looking at information on any past falls that have occurred. Research tells us that still the number one predictor of a fall in the future is someone who's fallen in the past. And so really understanding why someone's fallen and what they've been doing to try to mitigate their risk related to falling again. Medications, hopefully goes without saying that Older adults, especially older adults living in congregate care settings, tend to take a higher number of medications, and it's important that a pharmacist is involved in evaluating those medications and communicating with the physician to see where there's opportunities to reduce the use of multiple medications. And I do want to emphasize sleep as well as an important part of the history. Understanding how a resident's sleep patterns have changed. We know that, and research has shown that sleep has, or lack of sleep, significantly impacts decision making and safety in the future. So, making sure that their sleep issues are being addressed and that we're looking at that. The physical examination, which includes both by the physician and the nurse, and perhaps a therapist as well, is an important part of understanding what else might be putting this resident at risk for falling. Functional assessments, which should include gait and balance, strength assessments, even a simple test of asking the resident to get up and to walk into the bathroom and to watch them as they maneuver or walk through their community can provide good, important information to the team and where their potential risks might lie. And ultimately, environment assessments, both in the resident's apartment as well as in the common areas that might be creating a higher degree of risk. Again, these are all important elements to a fall prevention program. There's detailed information in that study program that I referenced on all of these areas. So I would encourage you to take a look at that. I do want to make just a couple notes on balance, gait, and strength testing. I think some of the largest body of research that we've seen in learning and understanding more about what impacts fall risk has been around what we know about balance, gait, and strength testing. And so having the ability to do some type of a balance assessment and understanding where a resident's risks might lie is important. The gentleman that you see here in the picture is currently on a product that does balance assessment. There are different products on the market that can do more of and provide more of an objective balance assessment. We're starting to see more assisted living providers looking at those types of pieces of equipment to integrate into their fall risk reduction program. And if you have any questions about that, we'll have some opportunity to ask about those a little bit later. But some of the tests that the equipment can do, in addition to what a skilled therapist can offer as well, are things like the Berg Balance Scale, the Timed Up and Go test, looking at gait with a dynamic gait index test, and the Tenetti Performance-Oriented Mobility Assessment, which is also built into some of these pieces of equipment. So I think this is definitely an area where technology is helping. Again, it's a snapshot in time. It's a picture of where the resident is today, but it can give you some good information, and especially as you're building out a care plan or a service plan for a resident, to understand what the specific areas are that you're going to focus on. So moving from assessment into focus, I do want to just talk just a little bit about who's on your safety team. When I mentioned this earlier, and this is a good question to ask of your team, and how to see how they feel about who else should be on the safety team as well. In senior living, it seems that the people who have the most interaction with the residents are the obvious people that should be a part of your safety team, but aren't always the team members that are included in some of the education and training around reducing fall risk. So I'd encourage you to really look at how you're pulling in members from your housekeeping team, how you're pulling in members from your maintenance team, members from your dining team, in addition to your CNAs, the nursing staff, and others who we might more typically think from a clinical perspective or a risk reduction perspective. But many times the other members of your team have more interaction, and they're in a resident's apartment. They might have more insight as to what is creating risk for the resident or when a change is occurring. So pulling them into the team and including them into that process and really elevating the focus of fall safety on a daily basis is really, really critical. And lastly, when related to process, the third idea I want you to take away is related to innovation. Now, when I talk about innovation, and we're going to talk more about some product innovations here in a little bit, but innovation in this context related to processes is really comes down to how we're thinking about changing a plan for a resident on a daily basis. So two specific areas that I want to just draw your attention to that have gotten some additional notice in the literature of late are related to, the first one is related to traumatic fall stratification. This is a big term and a lot of words basically to say that the injuries associated with falls are higher in residents who have issues such as osteoporosis or are taking medications such as anticoagulation. Where there's, we look at their level of fall risk in their assessment, but we should also be thinking about and looking at the risk associated with a traumatic injury if a fall should occur. So these are residents who, if we know that someone is on an anticoagulant, if we know that somebody already has osteoporosis or diagnosis of that their risk becomes elevated, and the team has a way of understanding who is at higher risk for an injury if they should fall. So we're seeing some of this be better understood, I think, in the literature. It's something to keep in mind, to think about from an innovation perspective as you're thinking about how you're organizing your residents into who's at higher risk and who's at lower risk. And then the second area of assessment innovation is around reducing risks associated with frailty. And frailty really, I think, is best assessed by a physician. There's good recommendations that are out by the American Medical Directors Association around how residents should be assessed for frailty. And there's good evidence-based interventions that if someone is diagnosed with frailty, that can help with preventing injury if a fall should occur. So things like exercising, both resistance and aerobic exercise, caloric and protein support from a nutritional perspective, the addition of vitamin D and the reduction in polypharmacy. So again, evidence is supporting the need to incorporate some of these assessments into a risk reduction effort. And again, as an operator of an assisted living community where you're admitting residents that are older and that have more chronic conditions, the risk for frailty is much higher. And so thinking about maybe some newer innovative ways to get some of this type of an assessment completed. Some of the providers that I've talked to have a nurse practitioner that visits the community that conducts frailty risk assessments on a monthly basis. Others are partnering with a medical director to provide more of this ongoing identification and support. And so it's something to keep in mind if you've not had that level of practitioner support in your community before. But this is one of those areas, if they are coming in, that I would definitely recommend that they add this into their assessment process. And I'll note, too, to make sure that they're sharing the results of that with the team, that it's not just ending up in their medical records someplace and not coming back to the team to let them understand what's actually changed. All right, so let's move into this next area, which is really related to practice. The three big areas here that I want to share with you are related to what I call tuning in, teamwork, and talk. So the three T's, I guess, related to practice. When I talk about tuning in, this seems like it should be a simple concept, but it's one that, again, paying attention and really encouraging staff to keep fall risk reduction as a high priority in their mind. I know that sounds simple, and that it's a lot harder to actually put into practice when staff are coming to work and they've got a laundry list of things that needs to get done that day, but always keeping it in top of mind and to really take the time to stop, to look at a resident, to take a breath, to do an assessment, and to really understand if there's anything that's changed with the resident. One of the areas that I like to talk about is related to the fear of falling. If someone has fallen before, we know that increases their risk for falling again, and it also increases their fear of falling. And A fear of falling can actually cause residents to pull back from participating in activities. It can, we can see a reduction in safe risk taking, if you will, participating in exercise programs where they might be concerned that they may fall again. And so recognizing where residents might be pulling back, and if they're not participating in the things that can help keep them safe, addressing those issues with them. The second area is around teamwork. We're going to talk a little bit more about that here in just a minute, and then talking with each other and improving competency through talking. So when we look at some of the best practices related to exercise, we know that the evidence supports that exercise has been shown to reduce the incidence of falls in older adults by 13 to 40%. That's a pretty significant number, and yet we know that there are many residents who don't want to exercise. And so the question is, so what keeps residents from engaging in exercise? If I was to pose that question to you, and this is what's hard sometimes about a webinar is that I can't see you, and to get your feedback on this, but I would encourage you to talk about this with your staff. I think that some of the common things we tend to see or hear are things like there's not activities that they like to do. They might feel foolish participating in certain activities with other residents. Some just don't want to take the time. They don't have the habit of exercise. The word exercise sometimes seems like a foreign term or has a connotation to it that is something that other people do, but not me. And so finding ways to understand what's keeping residents from participating in activity and encouraging them to participate in exercises that are building strength and improving balance is really critical. One of the really simple tactics, but impactful tactics, I think that can improve a resident's ability to be open to participating in more exercise and being engaged in their own fall risk reduction plan is where teams is the concept of teach back. And this is just some outcomes from a piece of research that was done that looked at developing a how-to guide, and it was kind of a pull-through from some other research that was done by the Institute for Healthcare Improvement. But there's a lot of evidence to support that, including patients and family members in the process related to fall risk reduction, will help the team uncover gaps in understanding about how to keep the patient safe, or in our case, the resident safe. And so spending time with the resident to talk through the process for how to safely get out of bed, how to safely get out of a chair, asking them to show you how they are going to get out of bed or how they're going to get out of a chair, looking at how they manage themselves when they go into the bathroom, their ability to maneuver themselves by the toilet, to be able to undress and to put their clothes back on. Asking them to demonstrate for you some of those areas, maybe things that they've never had to do before. They've never had to show somebody how they get out of bed. They've never had to show somebody how they get out of a chair. It might feel awkward, but it's also an opportunity to teach a resident about strategies for how to make sure that they are being safe when they're getting out of bed or when they're getting up out of the chair. And so making sure we're taking time to engage in teach back activities. And these are activities that with proper training and that the nursing staff, the therapy staff, the CNA staff can be engaged and involved in. And even other staff members can be engaged in the teach back opportunities as well. So asking residents to show you, asking residents to share with you the things that they're doing to keep themselves safe are really critical and important. Again, it feels like it's a very practical idea, but it's one that often gets missed in the busyness of a day, but it can be quite effective in creating their own self-awareness about where their risks might lie. All right, and the third takeaway idea here is related to, or the second, I'm sorry, is related to huddles. I want to talk just a little bit about the concept of huddles. This is an idea that's been studied and I think is just in some of the early stages of being implemented in senior living. A huddle is a process where the team comes together to talk about a specific resident. There's kind of two main areas where huddles might best be described or best be seen working. The first area is around risk reduction, and this is where a huddle is done at the beginning of each shift, where the lead care provider is connecting with all the team members that are on that particular shift that day. So if it's the housekeeping staff, the maintenance staff, the nursing staff, that they're coming together and they're talking about who's had a change in the last 24 hours, who are the residents that we're most worried about today, that we think are maybe had a change in condition, or they had a difficult visit from a daughter, or anything that might change their mental or physical state that day, that should put them at higher risk or higher awareness of a potential for risk for falling. And then, as I mentioned earlier, those residents that are at higher risk for injury if a fall should occur. So those are residents that are on anticoagulants, the residents that have had falls with injuries before, that they're on almost a higher alert to keep them in their line of sight and to connect and check in on them a little more frequently. And then the other place where we see huddles done is after a fall has occurred. And this is where we can see immediate learnings are shared with the individual or the team. And I wanted just to talk a little bit about that because there's been some interesting research done, and this is just one study that I wanted to share about what happens in the course of a huddle and why a huddle is important to do. There's a concept called naturalistic decision making that is a process that really looks at how people make decisions when they're faced with a complex or a challenging situation. This is one piece of research that showed the impact of naturalistic decision making, and how I really look at this as the idea is that when people come together and they're sharing information, that the research is showing that everyone brings a different perspective as to either what happened or what their concerns of risk related to the situation is. Over time, the detection of concerns and errors will be improved because the group as a whole is becoming smarter. So perhaps staff members that don't have a lot of background in fall risk reduction, perhaps your housekeeping staff, for instance, will start to learn based on listening to other members of the team talk about the areas that they're seeing that can potentially create risk. So through that association and learning how to naturally make better decisions together, the team as a whole is improving. And so the types of research has shown that the types of errors contributing to falls changed, the reduction in task and coordination changed, the proportion of falls with less adverse effects were increased, and so the fact that we were able to see less injuries associated with it. So there's good, this is again just one piece of research, but there's other research out there that supports the importance of this. And so huddles have been adopted in the hospital setting, they've been adopted in the skilled nursing setting, but they are, I think, newer in the assisted living space. And I would encourage you to think about how to incorporate the elements of huddle practice into your teams, and the benefits not only to reducing fall risk, but some of the other risks that may be associated with congregate living in senior care. I had a provider actually tell me last week I was at a conference, and she said, we were able to identify, we had some issues related to bullying in our community. And so when the team comes together in their daily huddles, this is now something that they've added to their conversation. And so recognizing who might be at risk for bullying and then what the team can do about it, they talk about that and then and that's been helping. And so so there are other benefits, I think, and this process of how do we help people improve their overall competency through the use of these types of techniques is important to look at. All right. So, and finally, I want to talk a little bit about competency. I know that staff competency is a big topic, and how do we help staff improve their competencies related to fall risk reduction. And competency really has these three elements to it, the knowledge, skills, and attitude components to it that are important. And I think techniques like the huddle technique, including staff in the daily assessment process, planning, and so forth, are all ways to help improve their overall competency. One strategy in particular related to improving staff competency is around assessing the environment. And again, this is a place where all staff have a place and a role to play when it comes to assessing the environment. We know that environmental hazards can be a significant contributor to falls in congregate care settings such as assisted living. And so understanding how to look at the risks associated with equipment, with perhaps monitoring systems such as nurse call systems, cords that are maybe attached to some of those systems, the impact that furnishings might play on fall risks, such as chairs that aren't the right height, or that are placed in strange spots in the room that are difficult for the resident to get to, the issues of lighting, walking areas, and so forth. So we're going to do, I'm going to share with you now just an educational activity that Renae and I have actually used with providers here when we conduct training, when we have staff or visitors come to Direct Supply. And what we call it is creating situational awareness. It's something that can really be done in any community. This is a picture, this was a staged picture that we created in one of our showrooms here on our campus. But I've seen providers do this activity where with permission, where they've taken pictures of either a common area or a residence room, and they use the picture during staff training to help the staff recognize and identify areas of risk that equipment or the environment poses when it comes to fall risk reduction for the resident. So the way that this would work is you put the picture up and let the staff either use a sticky note or start to identify and place a note on the picture itself as to where they're starting to see things that might create risk for the resident. So things like a dangling cord or a fall mat that's, next to the bed that's kind of skewed or create a tripping hazard. Clothes or other types of bed coverings that are falling off the bed, the placement of a walker that's maybe not where the resident needs to access it, or that's in the pathway of being able to safely maneuver through the room. Personal supplies in a place that makes it harder for the resident to access. So in this particular case, the resident would have to go around the bed in order to be able to get to their table, to get to their papers, and so forth. And so this is one way, but it can be a very engaging, simple way to get staff really honed in and focused on the environmental issues that might be putting a resident at risk. This is a great training tool for the housekeeping staff, a great training tool to use with your maintenance staff and others that may not have that kind of ongoing awareness. I think this is a great tool to also use with residents and family members as well, and let them help to identify where there might be risk that could be preemptively eliminated or changed in order to make it a safer environment. All right, so let's see, I'm just going to do a time check here. So let's get into talking about products a little bit. I want to just share, and when I think about the products today that are available that most senior living providers are utilizing. These are products that I would classify in kind of 3 buckets. So things that I would say are kind of the basics, products and technology that are more assist types of devices, and things that are more of a balance and strength nature. Renae's going to come up in a few minutes and share a little bit more about some of the specifics related to balance and strength, but I wanted just to talk a little bit about what I consider some of the things that are basics. The picture here shows a shoe. This might seem, again, simple to think about, but having proper footwear and to talk with the resident and the staff and the family members about what proper footwear is as well. And what residents really like to wear, what's comfortable for them. I had a situation in a community that I was working with a number of years ago that we talked with the resident and the family member about proper footwear, and that having shoes that had good soles on the bottom of them could help prevent with slips and trips and so forth. So the resident's daughter bought him a new pair of shoes, and he wore the shoes to the dining room, and he tripped in the dining room and fell. And through our root cause analysis, what we came back to realizing is that, yes, she had followed our instructions, and she'd purchased a good pair of shoes that would have been great for outdoor wear, but they were not as great for indoor wear. They had a heavier sole on them than the resident was used to wearing. They had more of a grip on the bottom of them, and so it required him to have to pick his feet up a little bit more when he walked. And when he walked into the dining room, the grip on the shoe caught on the carpeting and caused him to fall. So even our best intentions sometimes aren't the right intervention for the resident. And so I would encourage you, as you're thinking about just even some of those basics, that if a resident has a sensible pair of shoes in their closet and yet doesn't like to wear their sensible shoes, then what are the shoes that they do like to wear? And are there different kinds of shoes that we could get for them that might help them stay safer? So there's there's a lot to be said with just getting the basics part of it right, and that's a place where the residents and the families can really help. Talking about assist devices, assist devices such as walkers, canes, even wheelchairs, rollators, all of those types of devices can be both helpful and risky at the same time. And so I would encourage you to take a look at the assist devices that are in your community, making sure that things are sized appropriately. If it's a loaner device, if it's a device that somebody bought at a garage sale for their mom or dad, has it been sized to be the correct height? Is it in good repair? If it's a rollator, does it have wheels on it that are balanced and not, creating an off balance for the resident? So all of those simple things that even finding a staff member that is really interested in making sure that the residents have safety in their assist devices, and putting them in charge of doing routine safety checks on all the assist devices is helpful. I wanted to talk too a little bit about some other technology and products that we're starting to see more of in assisted living. Some of these are a little bit of a blend. We tend to see most of these being utilized in some degree in skilled nursing, and we're really starting now to see a lot more being utilized in assisted living as well as acuity continues to rise. So things like exercise equipment that can offer some individual monitoring and some progress monitoring. Bladder ultrasound, which we typically don't think of as a fall risk reduction product, but it can provide the clinical team with a better assessment of post-void residuals. It can offer some better understanding of urge and frequency. So if incontinence has been a concern or an issue related to falls in your community, this might be something that you want to talk with your physician or your nurse practitioner about. Lifts and or devices that can help with gait training. Renae will talk about one in particular here in a bit that's interesting. That's a combination that can help both with strength and maintaining safety. Just a note about hip protection. Hip protection will only work if it's worn, and so the question really there becomes more about, what improves acceptability. In those residents that are much higher risk for injury related to a fall, hip protection may be an area where you want to have a different kind of conversation with the resident and their family around looking at some options and some opportunities to help residents gain that additional level of safety and support. Adjustable height beds. These types of beds can help actually extend independence for residents that are able to manage the controls and helping with getting in and out of their bed a little bit more easier. So we're starting to see more of those being brought in and utilized in assisted living for sure. Wider mattresses, moving from just a traditional twin bed to something that's a little bit wider, can help address the fear of rolling out and can help reduce rollout. Bedside mats, my recommendation is, to really only utilize those as needed. I think in an assisted living community, those are probably more appropriate, perhaps in maybe more of a memory care unit where you've residents that you're concerned about rolling out of bed or injuring themselves if they roll out of bed. But mats can, in and of themselves, can potentially increase the risk for falls if they're not stored properly, or if they're left out, or if they're not in their proper position. So I would say utilize with caution. Underbed lighting is definitely an improvement in product selection that we're seeing, and especially at nighttime, and providing additional support for lighting. And we're starting to see different lighting options, I think, in AL as well, where the automatic lights that go on in the bathroom and more motion detective lights in general, that can be helpful, especially in the evening. Transitional care kits are educational kits that help promote health and safety literacy for residents and family members and can provide some type of additional education and support. And finally, I wanted just to talk a little bit about what the future holds. We get the opportunity here at Direct Supply to work with a lot of new startup companies, technology companies that are building or developing new products and technology for the use in senior care. No doubt many of you have been inundated with some of those ideas or seen some of the promises that come with new technology. I think Apple actually just released a watch, or their latest version of their watch, that has a fall detection or accelerometer built into it that allows for detecting falls if they occur. That being said, we're not seeing a lot of that type of technology yet really make it into assisted living for, I think, a couple different reasons. Some of it's related to cost, some of it's related to what to do with the information if you have it, how it plugs into existing systems, and so forth. So I think there is still work to be done in that space in order to create more of what I call a technology of healthcare ecosystem, where more of those types of products can be utilized by assisted living providers to create safer environments. So there definitely are products out there that are in companies that are working towards that. And I think over the next couple of years, we're going to see a lot more in that space that's going to be more affordable for providers as well and easier to implement. But these are some of the other things that we're seeing. Sleep monitoring technology has actually been out for some time, but the problem with some of that technology is affordability and how it plugs into, again, the rest of the healthcare system. So knowing how well a resident's sleeping, you may have residents moving in that have they've been tracking their sleep with their Fitbit at home, for instance, and can probably share some of that information with you. So being able to absorb some of that data into your system and help your teams know how to utilize some of that output is again, the really challenging part of it. Back to that idea around how we build out programs and how do we utilize these data elements to help with driving improvement falls into that. And so it's important that you're talking about the use of technology as a team and making decisions about where technology can really help you the best. I mentioned wearables. There's certainly a lot happening in that space, things related to gait assessment, balance correction, acknowledgement of a fall when it has occurred. So I think we're going to continue to see that those types of pieces of technology improve and be more useful by assisted living caregiving teams as well. Impact absorbent flooring is a really interesting a technology and a concept, and it is available today, but I should have put affordable impact absorbent flooring in front of that as well. I think that we'll continue to see the costs come down in some of that type of tech, and certainly there's good evidence to support that impact absorbent flooring can help reduce the risk of injuries if it's there and if a resident falls on it. There's tech happening and new technologies being developed, what I call non-contact room sensor technology, sensors in the room, machine vision, and artificial intelligence, Doppler technology. There's a lot happening in that space right now, and I think in the next few years we're going to start to see some of that be more widely used in assisted living. You may have seen there's a product on the market that offers an airbag for hip protection. An airbag deploys, it's got an accelerometer in it, an airbag deploys if a resident's starting to fall. Again, innovation and new tech that's coming our way that may or may not be acceptable to some residents that are interested in wanting to use it, but certainly interesting, and I think it speaks to a lot of the interest in trying to be solving for the problem of falls and falls risk reduction in our space. So with that being said, hopefully you came away today with some 3 ideas within each of these big areas related to program, process, products, and practice, ultimately all focused in on the resident themselves and what's acceptable to them and what they're interested and willing to engage in. I did provide a list of references here, and I understand we'll be able to share these slides out with you and your team afterwards. And with that, I think we'll go into some questions.
Thank you, Liz, for that valuable information. We do have time for questions. The first question is, would you mind showing the website for the study again?
Sure. It's the CDC site, cdc.gov/study, STEADI/patient.html. And there's really great resources out here. I would encourage you to check it out.
And now for anyone interested in learning more about some of the fall prevention products that DirectSupply offers, please welcome our product consultant, Renae Buyeske.
Hi, everyone. Thanks so much, Savannah. So for those of you that are still online for us, like Liz mentioned, there's a number of products that can be beneficial when we're talking about this topic and can be used in wide varieties throughout the building. So I'd love to just go through a couple of those for you to give you an idea of a couple products that are available. First product that we want to talk about today is called Move More. So this is a good product for lower extremity strength. The concept being, you can kind of see in the photo on bottom left, it's a board, so very portable, easy to move around the building, easy to store and get out of the way when not being used. And the bands strap to the feet with any footwear or anything that they're wearing. And the bands that connect to that are similar to like a TheraBand. So it can be stretched in different ways and things like that, and can be set with different amounts of restriction so that it gives them an idea of how they can go ahead and function and use that. It's lightweight, it's portable, and there's over 30 multi-directional exercises that are designed for both individual use or group setting. Like Liz had mentioned, sometimes exercise can be that horrible E word and people do not want to participate or be a part of it. So something like this might be fun to engage in a group exercise in a group setting to really be able to get the benefits from using the product and not have it be something that is tasking and make it something that's a little bit more fun for the resident to engage in. A product like this will promote strength in hips, knees, ankles, and the feet. So really good for lower body and lower body strength. Next, we have a great product for injury reduction. This is called Impact Active, and these are hip protectors. Hip protection isn't new to the market. We have all experienced and seen different types of hip protection already and before. But what we see and what research has kind of shown us that hip protection is really only effective if there's compliance, meaning that the resident's going to wear it, it's going to be on, and when that fall actually happens, the product's on and the pads are there and available to protect those hips from fracture. Some of the unique benefits of Impact Active is that it provides the helpfulness of helping us with compliance in that way. Pads are sewn directly into the garment, as you can see in some of the photos there, so no chance of that pad being removed, lost in the laundry, or anything like that. Always in the right position, always in the right spot to protect that hip when they fall. These garments can be thrown through a commercial washer and dryer, so we don't have to worry about any special washing needs or anything like that because the pad is sewn into it. That pad can go through that commercial washer and dryer. They're flexible, they're lightweight, they're very thin, so they can be hidden underneath residents' clothing, and we don't have to worry about them, sticking out like a sore thumb or feeling like they have big, bulky pads underneath. Last but certainly not least, Impact Active is unique in where it offers multiple different types of garments. You can see 2 colors up here, black and white, so 2 colors, and they offer 4 different styles. The women's version, which is what we see on the right in the white, a full fit, which is what we see on the left in the black, so more of a generic, and then they also offer a men's and an open, so the open being for residents that have a harder time stepping into a garment from safety perspective. So a large variety that we can easily outfit and adjust based off of that particular resident need to comply with that. So that is Impact Active Hip Protection. Next, we have a really great product from SciFit. This is the SciFit Latitude. This is very unique. When first looking at it, I think everyone thinks stepper, what we typically see, another great product when we think of building lower extremity strength and things like that. This is for lateral stability and a good exercise to work on that and work on those muscles for that swaying left to right and protecting from that movement. So although it looks like a stepper, when you get on it and start to move it, it actually goes in a circular motion. So you're kind of almost making figure eights, if you want to say, with the feet. And again, the idea being to build out that lateral stability and that lateral strength when some of those assessments show that that's where residents' weaknesses are. So it gives us an opportunity to not only do the traditional exercise like the stepper to build out those lower extremity and those leg muscles, but then also go one step further and work kind of a more unique area that traditionally we haven't had a piece of equipment that has been able to help us with that. So this is the SciFit Latitude and a new product to the Direct Supply offering this year. From an assistance standpoint, we love talking about the Riften Tram for anyone who has seen this before. This product is a little bit unique in the aspect that it does some traditional lifting methods for us. You can see in the photo here, it assists in helping us from a sit to stand, like we would normally use with a traditional lift. However, in addition to this, once we get to this gentleman to a standing position safely using the Riften Tram, we can then use it to do some walking and some assisted gait training. The benefits for that are not only for the residents, but also for your staff members. So the concept being that this gentleman would be safely harnessed in for the upper body harness and then any additional slings that we want. The caregiver can be in the position that she is in and walk with that particular resident. If for some reason they fatigue or are having any problems while doing their walking, the lift and that Riften Tram would be providing that support versus, say, a caregiver having to depend on lifting, supporting, holding that particular resident in that situation. So we can do safe gait training with less staff members and in a much safer environment for both residents and caregivers. And then using it in multiple different ways. So again, using it for traditional sit to stand, using it for gait training, and using it for a couple other lifting abilities is a good, unique piece for a universal option for buildings to invest in. Last but certainly not least, I want to end on engagement and exercise. This is a product, Gentronics, that we introduced to our direct supply offering earlier this year. Liz had talked a little bit earlier in the presentation in balancing for assessment, and this product will do just that and more. The idea being that we can use this both up front, so to do some assessment from the beginning to say, what are we benchmarking at? What is that particular resident's capabilities, strengths, weaknesses, areas of focus? And then from there, we can use that information to do engagement and exercise to build out those particular areas that they need help with. That can be done through assessment activities, that can be done through games to make learning and exercise a lot more fun. And this product here is very versatile in the aspect that we can do it in multiple different positions. Two of the examples that we show here is from a standing position, also a seated position. There are also games, exercises, and assessments that can be done from a supine laying down position. So it really is a very portable and easy way to get to all the residents in our building, no matter what their capabilities are. We don't necessarily have to be standing on a machine and on a piece of equipment. I can just wheel that TV around, to the bedside and do some of those exercise while they're in that laying position as well. This will track and measure data throughout time, so we can kind of see on the upper right there some of the charts and graphs and things that we can compare to. So it's very easy for us to share with family and friends and even staff to say how are they improving and how are we working on things over time. So the system is really great and does a number of different things that, again, we can help do some engagement and additional exercise and assessments for those particular residents. If anyone has any additional questions on any of the products that we showed today, or would you like additional information, feel free to contact your account manager, and we're happy to share some additional details for that.
Thanks so much, Renae, for that great demonstration. Like she said, if you have any questions about the products discussed or would like a video or demo of any of that we may have, please reach out to your Direct Supply account manager. For more information about upcoming webinars, to review past videos, please visit directsupply.com/webinars. Thank you again for attending.